Hi there, this is Dr. Jason Strandberg from Minnetonka Mobile Wellness. Today we're going to talk a little bit about migraine headaches. Migraine headaches are a very common reason why people come to visit chiropractors and neurologists, and it is something we see quite often in our patients with Lake Minnetonka Mobile Wellness. So a little bit of background information. Migraines are a very common type of headache. They are what we would call vascular in nature. Vascular headaches are typically, at least in part, due to dilated blood vessels in and around the brain causing pain. They tend to be pounding and throbbing in nature, and then they often start on one side of the head and they may stay there or they may spread, but they tend to have a pounding nature that at least starts on one side of the head. Migraines tend to begin at puberty in most people, so if you're going to have migraine headaches throughout your life, you will probably start seeing them at puberty. They tend to affect people most frequently between the ages of 35 and 55, and they are twice as common in women as they are in men. In the US, over 37 million people suffer on a regular basis from migraine headaches. Oftentimes, migraine headaches are preceded by an aura or a prodromal set of symptoms which may last minutes or hours before the headaches start, and then the headaches themselves will last a few hours to a couple of days, and they will typically be moderate to severe. In fact, many of them are so severe that they are completely incapacitating while they are going on. Classic migraine headaches are migraine headaches that most people would think of when they hear about migraines. They're preceded by an aura. They begin on one side of the head, and they typically stay there. They are accompanied by nausea and vomiting and sensitivity to light, to sound, to smell. Common migraines are exactly what they sound like. They're common. They happen more often than the classic migraines. They may or may not have an aura. They will often begin on one side of the head but spread to cover the entire head. And they may or may not have nausea, vomiting, or sensitivities to light, sound, or smell. Now, migraines are diagnosed typically by just history and physical examination. We'll ask questions about your family history, about your lifestyle, what your exercise, eating habits, drinking, smoking habits are like. Family history of migraine headaches makes you far more likely to have migraines than if you don't have a family history. And the consumption of certain foods and beverages or other activities also make it more likely for you to have migraine headaches. In fact, there are certain foods and activities that we will refer to as triggers of migraine headaches. Your doctor might ask you to keep a journal, and in fact, we ask all of our migraine patients to keep a journal of their headaches, but also of their daily food and their food intake, beverages, any activities that might contribute to this, including stress levels, exercises, smoking. And in some cases, your doctor might order blood tests, x-rays, MRIs, or CT scans to rule out other causes of your headaches. If we think there's an infection in the brain, we have to order a lumbar puncture to rule those out, but that's very, very rare. Typically, most patients with migraine headaches, the diagnosis can be made based on a history, a physical, and just on the description of the headaches themselves. Now, in the last slide, we talked about triggers of migraine headaches. Common migraine triggers include things like caffeine withdrawal. If you're a 4 or 5 cup of coffee a day person and you suddenly stop drinking coffee, you're probably going to have a migraine headache. Alcohol consumption can trigger headaches because it can lead to dehydration. Dehydration has a similar effect by removing some of the water from your blood vessels as other things that would cause your blood vessels to dilate. Now, red wines and certain other alcohols that have tannins in them will actually cause the blood vessels to dilate in addition to the slight dehydrating effect. And so they will often be significant triggers of migraine headaches. Deli meats and aged cheeses are migraine triggers because they contain nitrites, which have an effect of dilating the blood vessels. Hormonal fluctuation can trigger migraine headaches, which is why we often see people have migraine headaches around the same time every month associated with their menstrual cycle. For some people, exercise or stress can induce migraine headaches. Typically, we're talking about very, very vigorous exercise or high levels of emotional or physical stress that are triggering migraine headaches. And in a handful of people, certain sights, sounds, and smells can trigger migraine headaches. In particular, bright lights or flashing lights can trigger migraine headaches. And a number of people can have perfumes or colognes. Very strong smelling perfumes or colognes can trigger migraine headaches. How do you treat a migraine headache? There are a number of ways to treat migraine headaches. Over-the-counter medications like Excedrin migraine tend to help quite a bit with mild to moderate migraine headaches. Now, there are 3 active ingredients in Excedrin migraine. There's acetaminophen, which is the active ingredient in Tylenol. There's aspirin, and there is caffeine. And of the 3, the caffeine has the biggest effect on migraine headaches. If Excedrin doesn't work, then often we move to prescription medicines like Imitrex or Zolmig, which will relieve the migraine headache that's going on right now, or if you take it during the aura or the early stages of the migraine, you might be able to nip it in the bud and not get to the point where it is so severe. Now, to prevent migraines or to at least decrease their frequency, people may take certain drugs, beta blockers, calcium channel blockers, or tricyclic antidepressants. Amitriptyline is actually a very effective migraine medication. For some people, anticonvulsants like Depakote will help with migraine headaches. And in the last few years, people have started using Botox injections at the base of the skull to help relieve migraine headaches for a more long-term period of time. If you don't want to deal with the side effects that many of these medications have, there are other possible treatments. Chiropractic manipulation, acupuncture, massage therapy, and physical therapy have all been shown to be effective at treating migraine headaches and reducing their frequency. And in fact, the World Health Organization lists manipulation and acupuncture as some of the more effective methods of treating migraine headaches. Now, if you come to us at Lake Minnetonka Mobile Wellness to get your migraines treated, we're going to start with the lifestyle stuff. We have a multifactorial approach. We're going to look at your lifestyle. What are you eating? What are you drinking? What's your exercise habits like? What are your sleep habits like? Do you smoke? Do you use any recreational drugs? We're going to look at those and see if they may be triggers. We will typically use chiropractic and acupuncture to treat the symptoms of an ongoing migraine or to prevent future episodes. And in fact, I have patients who will call me with the aura going on and set up an appointment as quickly as they can. And quite often we can keep the migraine from coming on or becoming full blown. Once we've treated that and it's no longer a problem, we will start to look at treatment plans that'll probably include chiropractic or acupuncture, but will definitely include exercises and stretches that can help you deal with stress, tension, with muscles, and other things that may lead to or cause migraine headaches. Massage therapy can be added to help reduce the frequency of your headaches. And in fact, the massage therapy can be paid for with your HSA or your flex plan, as long as you have a prescription from a chiropractor or a medical doctor. So we can obviously give that to you in-house. If necessary, we will work with your neurologist to find an appropriate combination of prescription medications, over-the-counter treatments, functional treatments to relieve your symptoms and decrease the frequency of your headaches. Now, since we bring our care to you, we do house calls, you don't have to deal with the stress of driving to an appointment, sitting in the waiting room, waiting for your appointment, and then having to drive back all while you're suffering from a migraine. We'll come to you to make this less stressful. And us coming to you means you can keep it to yourself in a quiet, dark room, or whatever it is that you need to do to keep the migraine from being more severe. And then when we get to you, you can stay at the house until the migraine completely subsides. And so Lake Minnetonka Mobile Wellness, we bring our care to you so that you can get better and you can perform your best without the stress of an office visit. We have chiropractic, rehabilitation, physical therapy, massage therapy, acupuncture, health and wellness coaching, and care at your home or office. We come to you. Our goal is to help active, high-performing people be able to be their best at work, at play, and for the people that matter the most. I will see you on our next video blog and hope to see you for care.